Hi, this is Paul Howell, Managing Editor for Healthcare Asia magazine. And today I'm presenting the Healthcare Asia Awards for 2021, celebrating all the best achievements and milestones for hospitals, clinics and service providers across the Asia Pacific region. Winning the COVID Management Initiative of the Year award for India was Aster RV Hospital, and I'm joined now by its Chief Operating Officer, Dr. Prashant. Dr. Prashant, thank you very much for being here and congratulations on the win.
Greetings and hope everyone is keeping well and staying safe. It is an honor for us to receive the Healthcare Asia Award for the COVID Management Initiative of the Year, India. Receiving this recognition, such as this, will further fuel our desire to revolutionize and constantly push the bar of healthcare practices up in our geography. I thank the Shalton Media Group and the jury for recognizing and awarding us for our efforts and strategy to face the current pandemic challenges head-on and strive to uphold the core values of our hospital. This was achieved by adopting new protocols based on updated scientific information and guidance from our thought leaders across the Aster Group, which enabled the leadership team and staff of Aster to plan and respond swiftly to the daily dynamic, uncertain environment created by the COVID-19 onslaught. I would like to thank our chairman, Dr. Azad Moopen, for being the torchbearer of the highest healthcare practices and a guiding light for us during these challenging times. I would like to extend my gratitude to Dr. Malathi, our Group Chief Medical Officer and Group Chief Quality Officer, Dr. Harish Pillai, CEO of Aster India, who has gone out of his way to ensure that each hospital under his purview stayed focused and motivated. It goes without saying that Dr. Nitish, the CEO of Aster Hospitals Bangalore cluster, has been a bedrock of support and guidance from the start of the pandemic. I would like to thank every single one of our staff, doctors, nurses, department heads, who have gone above and beyond to serve the ailing population during this pandemic. It is again an honor to be a part of such an enthusiastic and skilled workforce, and we'll continue to put in our best efforts and serve the society to the best of our abilities for the years to come. Thank you.
Thank you very much, Dr. Prashant, and congratulations once again. We're also joined by Dr. Shugato Chakrabarti, who is the Chief of Medical Services across the Aster RV Hospital. Dr. Shabati, thank you very much for joining as well.
Thank you, Paul.
Dr. Shabati, can you tell us a bit more about the strategic preparedness and response plan for the COVID-19 pandemic? What do you think were the keys to its successful implementation at Aster RV?
What happens is any battle is won or lost first in the mind. And as a clinical head, one of the things that we did as a strategy was to bring our clinical team together, have an alignment of thought. The whole world was blindsided by the COVID-19 pandemic in 2020, and its far-reaching impact did catch our businesses and the society at large all by surprise. It put the whole world in the VUCA zone, which is basically the volatile, uncertain, complex, and ambiguous. However, after the initial disbelief, we had to get into acceptance mode. We had to understand that this is a battle we have to fight, we can't escape, and we have to win. So some of the things we did immediately was to have very clear COVID governance systems, understanding the COVID vulnerability of different departments, both clinical and non-clinical. Clinical would include the operation theaters, the ICUs, the OPDs, the ER. Then we had developed dashboards, systematic trend analysis. Clinical excellence measures were achieved by implementing updated guidelines. We were always following what is going on in the recent updations from the CDC, from the WHO, and other guidelines, and the national and state guidelines that are being focused on our local needs. Then, of course, various measures like the people excellence measures, where we talk about working from home, ensuring they don't get burnout, also supporting them with something known as a COVID, we had a Serenity app, which is a clinical psychology app, which helped the staff, the employees, the paramedics to be able to, have a kind of a consult online with this app. Similarly, we had service excellence and patient accessibility measures, with Aster COVID tool and digital connectivity to balance patients and psychological counseling and care provision. Risk mitigation, very important. As I said, various departments with vulnerability, we had to ensure the risk mitigation measures were taken to ensure that they are up to and battle ready to face the onslaught of COVID. And business continuity efforts, both clinical and operational. We stepped up the skilling and training of nurses because we knew that those who are at the forefront would need the back-end support, would need other people from other departments to support in, whether it is neurosurgery, whether it is cardiology, whether it is various other departments which had to come get upskilled in critical care, and they were there battle ready the moment the front line would give way. Now, of course, developing the content around employee and patient education, very important. We did not let our webinar trainings for our people with the updated knowledge of what is coming up in terms of the newer developments in the clinical scenario across the world. It was conveyed and ensured that all staff are aware, especially the clinical staff who are managing those patients. In short, it was an all hands on deck approach, and everyone had their roles clearly cut out. And I'm happy to say we prevailed and we delivered. Despite the difficult demands and obstacles, foreseen, the proactive and systematic implementation of the key generic and specific actions facilitated effective and hospital-based management during a rapidly evolving pandemic as this one. The overall objective was to augment our already existing processes and focus on the preventive action to reduce COVID-19 risk and enable Aster to make a timely and effective response. Priority measures were identified based on evidence-based references like WHO, CDC, national and local government guidelines. Thank you, Paul.
Dr. Prashant, coming back to you, what has been the overall impact of the pandemic on your hospital and staff? And what are some of the initiatives that you've implemented to motivate them during what is an unprecedented and extremely difficult time?
So in the fight against COVID-19, Aster now takes care of large number of COVID positive cases in our hospitals, along with hotels and other nearby accommodations. Our healthcare workers are exposing themselves to personal risk and sometimes staying away from their families. Frequent talks and meetings were conducted to create awareness among the employees on the impact of COVID-19 and training videos to follow every safety protocol during the pandemic. For example, process like donning and doffing process, COVID appropriate behavioral process. These were some of the videos that we created. The initial anxiety and apprehension were promptly addressed among staff. All of them showed confidence in their conviction to fight this battle bravely. We recognized, appreciate, and celebrate their commitment by motivating the frontline COVID warriors across our group through constant engagement activity from the unit leadership. Aster RV Hospital covered all healthcare workers with medical insurance policy, namely the COVID Kavach and Suraksha. These are two policies available in India, which provided cashless treatment and a separate COVID risk allowance to all the staff.
And what's next for the hospital? Where do you see Aster RV Hospital heading towards over the next 5 or 10 years?
We are looking at establishing Aster RV Hospital as one of the most trusted healthcare providers through the creation of a holistic healthcare experience for patients. This is by 2030 is our vision, through their journey from illness to wellness. So how do we do this? With top-notch professionals, advanced technologies, and high standards of integrity to consistently provide the best patient experience. The other thing is to adapt and implement technology-driven healthcare services to provide seamless omni-channel patient experience across the geographies through innovation and digital transformation. Also, build a sustainable future for Aster by defining a path that creates shared values, benefiting the organization, the community, and the environment. We are looking at being among the global best employers by 2030, where every Asterian finds purpose and aspires to be the best in providing care to our customers.
And finally, Dr. Prashant, how do you feel about winning this Healthcare Asia Award particularly after the continuing battle that is ongoing with the pandemic at the moment?
This journey has been arduous, fought with uncertainty and unprecedented business challenges, but has been fought on many fronts with passion and indomitable spirit by the team at Aster RV Hospital. What we have faced, I hope, will become stories that we'll tell our future generations. The storm is not over. The award goes a long way in renewing our energies and motivating the entire Aster RV team, revitalizing us to keep fighting. Our journey to navigate the COVID-19 pandemic has provided a unique experience and challenge to deliver the best of patient care in a rapidly evolving and changing situation without making any compromises to patient or staff safety. I'm sure we will come out at the other end a bit battle weary but successful. We are fortunate, like most other hospital groups, to be a part of the care delivery system in this fight against COVID-19. I dedicate this award to the medical professionals, including the committed doctors, nurses, paramedical, and support staff who have worked and are working tirelessly round the clock to save lives, and the support that we received from our senior leadership.
Dr. Prashant, thank you very much for joining me, and congratulations to you, to Dr. Shigato, and all of your Asterians, wherever they may be. Congratulations once again.
Thank you so much for the award, and we are honored to receive it. Thank you.